Good afternoon, good afternoon, good afternoon. Good afternoon. Thank God it's Friday.
Yes, it is Friday.
Yeah. And you know what that means, right?
They probably forgot, but we might want to remind them what Friday is, Marek.
Oh man, Friday is another edition of CareSouth Carolina Community Live Podcast. And I'm just gonna say this right here.
That's right. Go ahead. That's right. That's right.
Get it on, Marek.
We back. We back. We back.
That's right. We back. We back.
Yes.
Yes, we took a little hiatus, a little break. Everybody sometimes have to step back and refresh a little bit.
Right.
But we back, and we have today a wonderful Friday, packed full of information.
Mm-hmm.
And we have arguably two of the most dynamic women in the state of South Carolina.
That's right.
We have CareSouth Carolina CEO, Miss Ann Lewis. And the Chief Operating Officer at the South Carolina Primary Care Association, Miss Vicki Young. Just taking plug. My sorrow. All right.
Yes.
All right. So listen, it is Community Health Center Week this week. Community health centers all over the nation, including yours here in South Carolina, including yours here in the PD, have been celebrating all week long with different activities for the public, different activities for our patients, different activities for the staff. We've just been having one big party here and in celebration of National Community Health Center Week. But what we're going to do today is we're going to kind of kick this thing off and just kind of talk about why do we celebrate this and what are community health centers and where did they come from? What are the origins and why are we here, right? And then we're going to talk about CareSouth Carolina and our humble beginnings and where we at right now. Can we do that today?
Yes.
Inquiring minds want to know. Inquiring minds want to know.
Okay.
Because they're trying to figure out why we had so much fun this week. Why CareSouth was so much in the communities. We're doing a whole bunch of, we always out there, but we did some special things this week. So
we did.
I want to know why this week? Why?
Well, we about to tell them.
Yes.
We about to tell them.
But I say, let's do it.
Well, we're going to step out the way.
Yeah.
And we're going to hand over the reins to turn the keys over to these ladies, and we're going to watch them work.
That's right.
Oh, Vicki, you go first.
Okay. Well, the why. Why are we celebrating? Our National Association of Community Health Centers years ago decided we need to make sure people know about community health centers. They know about the movement. And since then, we have been having this grand national, actually even beyond the contingent United States party, because there are health centers in other areas, in Hawaii and Puerto Rico, et cetera. So we want to make sure everybody is partying during this time. I will say, even before this, South Carolina is always, starting something new in the health center movement. So we were partying even before National Health Center Week, making sure people knew what services were available and what the community health centers were about. And I often say, I take my hat off and we stand on the shoulders of directors like your own Ann Lewis, Roland Gardner, and others who have for years been doing the work and touting the story. So I will definitely say that this national celebration is to highlight and celebrate the work of community health centers and the communities that they serve. And it is about making sure that you know about the services, that you know about the people who are engaged in providing them and receiving the services, and applauding and appreciating them. They actually have days set aside. So we've gotten to that point where we're able to share and dedicate days for the celebration. We started off Sunday with Public Health and Housing Day. So there are health centers that provide services specifically to public housing entities. And then Day one on Monday, we moved on to healthcare for the homeless. There's a special part of the health center movement that focuses on making sure care is provided to those who are experiencing homelessness in whatever form. Tuesday, we moved on to Agricultural Worker Health Day, which is also big on the East Coast. As well as the West Coast, because there are persons who are working with our growers to make sure that we're able to have fresh fruits and vegetables and other produce and actually other parts of agricultural industry available. So we celebrate them on that day. And then Wednesday is Patient Appreciation Day, because if the community didn't say that it was important to have community health centers and we were not there to serve them and they did not walk into our doors, then there's no way that we could have the type of movement that we have now. So definitely appreciate our patients. And when we talk a little bit about the start of the community health center movement, and to this date, the care driven by community health centers and what community health centers do, it is driven by patients. Patients have a key role in deciding what's going to happen in their communities and within the community health centers that serve them. So, of course, we want to appreciate our patients. And then stakeholder appreciation, because we know nothing gets done without partnerships in this world. And people who think we stand alone, well, that's not the way the world works. One way or another, you need someone else. So we definitely appreciate our stakeholders, those people who see the importance of community health centers and lend their voice to sharing that with others. And of course, Daniel, you, Marek, Ms. Lewis, and others, Health Center Staff Appreciation Day, because you are out there on the front lines day in, day out, and it has been witnessed to the nth degree, the highest degree over this last 2.5 years. So you are so appreciated for the work that you do. And that's today, Health Center Staff Appreciation Day. And then tomorrow, we round it out with Children's Health Day. So we have gotten to a point with the National Health Center Week where we've decided it needs to be divided, if you will, or categorized by the different days so that we don't miss anyone in sharing the appreciation and highlighting the work. Ms. Lewis, did you want to share anything else about National Health Center Week or your thoughts about Health Center Week this year or previous years?
You know, this year, and we were laughing about this earlier, it was like, oh, mercy, boy, today is a sigh of relief. We've gotten some amazing things done this week. I send out a video, sometimes to all staff, sometimes weekly, sometimes I don't make it quite weekly. And I reviewed with them. And when I reviewed with them, I realized how much fun it's been. We've had ice cream sandwiches, pastries, goodies, some gifts that came out. We've had things going on with legislators. Our providers had appreciation. It has been a lot of fun. It's been a lot of work. Don't get me wrong. It's been a lot of work. I'll be enjoying my Saturday off tomorrow. But you know, it cements, for me at least, every time this week rolls around, how much breadth that FQHCs cover across the nation, and here at CareSouth, it's humbling, to be honest. So yeah, it's been quite a week.
And you are an example, a stellar example of what has been happening this week at the State Association, which I am an employee of as Chief Operating Officer. We had the pleasure of compiling all of the events. And it was exciting to see all of the events roll in. And then as staff, we got to go to some of the events. And that is so much fun as well. So I will say this has been a big party in South Carolina, a big safe party in South Carolina, because of how the centers have been so creative in offering activities that also keep people safe during our current environment. Now, I'm going to switch a little bit because I heard you loud and clear, Marette, and you too, Daniel, about, well, what are these health centers? So I'm going to take it back a little bit and share a little bit about health centers and how they came into being. What health centers are community owned, and that's key. Community owned and operated nonprofit businesses. So not only do they provide for access to primary and preventive health care that's affordable to everyone, they also feed the economy in their local communities. Isn't that wonderful to have such a model? And it's a big, robust model. So the health centers have the ability to design their services based on the needs of their individual communities and really address the needs of persons living in their communities around the areas of healthcare, but not just healthcare, but to also address needs, if they are able to, that impact healthcare. Those things that you hear called social determinants of health, and then now we move to social drivers of health. Well, back when this started, they called it the fact that they had economic and environmental issues that impacted people's health. So community health centers have been dealing with those social determinants of health or drivers of health since inception. When did it start? This is an interesting story that I always find very exciting to tell and actually reflect on. In 1950, Dr. Sidney Clark and his wife, Emily, created or worked with the community in South Africa to create the first health center in South Africa. And its mission was the mission that we continue to have, and that is ensuring that healthcare is provided and accessible to all members of the community, regardless of their position, their economic standing, whatever in the community. It is a model that is there for everyone to access, and particularly making sure that no one is left behind. I know we use that term a lot, but no one is left behind in having access to healthcare and other services. So back in 1950, that one was created in South Africa. And then we had the American version be developed in 1965. So you had Doctors Jack Geiger and Count Gibson who had studied this model and said, well, why can't we do this here in the US? Because there is need for such entities in the US. And they wrote a grant that became the Community Health Center model and started the movement. And other key people who were involved in the movement were John Hatch and Robert Smith, who came together. And I imagine them sitting around the table somewhere, like Miss Lewis, maybe your boardroom or in your office when you have your staff come together, and they're thinking, well, what are we going to do? You know, how can we fund this? How can we make sure that this comes together? Because this is a great idea. So they rolled up their sleeves, just like y'all roll up your sleeves on a daily basis, looking at how you can expand your services. They rolled up their sleeves and they said, let's write this. This might not be the right opportunity, but we're going to submit it. And they submitted it in a total different area than healthcare and received the funding because someone saw the importance of this model being moved forward. And it is a model that looks at not just healthcare, but looking at how those social and environmental factors can impact health. So hence, we had community health centers start in 1965. Started with two, one in Massachusetts at Columbia Point and the other in Mount Bayou, Mississippi. During that time, as many of you know, some may have been a part of the social fabric during that time. Others learned about it and know about it through being educated about it. But we know that that was a tumultuous time. Unfortunately, not unlike some of the times we were still experiencing, maybe in a slightly different way. But there was a lot going on, a lot where there were needs that needed to be comprehensively and holistically addressed. And that's exactly what this model sought out to do as it was birthed during the civil rights movement. So social action has always been a key part of the health center movement. And I'm just so excited to be a part of this movement. Now, in South Carolina, centers were forming around the same time. And then some of them, with the funding that was received, actually applied for and received funding to be formally looked at as community health centers that receive some level of funding from the federal government. And one person, again, we are really lucky to have her on this podcast with us, Miss Ann Lewis in the PD area said, "Yep, we're going to do this." And y'all know that's exactly probably how she said it.
Oh, yeah.
We have the idea and we're going to do this. We're going to make it happen.
We can do it.
And so I'll take an opportunity to stop and then shift it to Ms. Lewis to talk about how during that time she and others working with her picked up and looked at moving the health center movement forward in the PD area.
You know, I when I talk about community health centers, I remember and I reflect back. We've gone by a lot of names. When I first started, and I've been with this organization since 1980. I know, don't count on your fingers. Don't do anything like that. I see that. You're thinking, oh, how old is she really? I started when I was 12. So when we started, the funding, the original funding, as Vicki was talking about, wasn't even through a health entity in the national government. It's through the Office of Economic Opportunity, OEO. And then as things progressed, the war on poverty progressed, civil rights began to take traction. Did it get moved into Health and Human Services and a bona fide health entity in the government? And at the beginning of who we are now, it was part of the Public Health Service Act Rural Health Initiative. Those two entities that originated this movement and some of the other subsequent ones tended to be urban or larger entities. And pretty soon the rural health congressional leader, the rural congressional leaders were going, wait a minute. My folks need some help too. We, it's 30 miles, 20 miles, what have you, to a doctor. So this initiative kind of began, that there would be rural areas that were targeted as high need areas. Data began to get collected and so forth. And at that time in South Carolina, we had what was called health systems agencies, HSAs. And in the PD area, they kind of looked at various areas of need and helped facilitate embryos, kind of like areas where development could be. And they looked at Society Hill up there in Darlington County. And there was a very large group in Society Hill that were active in a lot of different things. So it was kind of natural when they came together, and the Health Systems Agency kind of gave them the ins and outs of applying for a grant. It coalesced. It came together. So they applied for the grant. They got their nonprofit corporate status. Their name back then was Society Hill Family Health Clinic. We saw our first patient in 1980 under that name in only the one location in Society Hill. There were 4 staff, 4 of us. That was it. I was one of those staff. But it was a whole. It was so different back then. I can remember working on the grant. The grants were, of course, in paper, and they were like that thick. You had a lot of hoops to jump through. But at the heart of everything was community. The boards had to actually reflect at a minimum. 50% of the board members had to be actual patients that were going to use the services, and it's remained that way to this day. At CareSouth to this day, I'm really proud to say 100% of our board members, we have 12 board members, are actually patients, real patients, not just ones that fly by and get their blood pressure checked occasionally. So there we were, beginning as a little small office, Society Hill, 4 staff of us. And honestly, personally, it was like I wasn't really sure. I'm born in the PD area. I'm born in Dillon, South Carolina. But I had previously, right before I came back home, you know how us young people have to be. I'm going to include myself in that group. You got to kind of go off and find your pathway wherever. And I ended up going to California, far away from South Carolina as you can possibly get, and got really homesick and said, I got to go back. I got to go back home, and I got to have a job. I got to do something. And this became open, and it was something new, and not really sure how it was going to turn out, and a little bit confused about what were these rural health initiatives and what's this about community based. And then you start realizing, or at least I started realizing, how deep the need is. How many people in Society Hill, and I would go out and talk with people and visit with patients, go pick them up. Society Hill it still is, it's very small. Folks would say, I can't get in. Can somebody come and get me? Go pick them up. There wasn't before 4 or 5 of us. And I remember very vividly seeing what the real need was. The need where folks didn't have power, didn't have, in many cases, electricity. Heartbreaking. There's not many times in our life that we can work and know in our hearts that the true purpose and the difference we're making is profound. And it's God's purpose, simply put. I think that switch for me clicked on the day I visited an older lady who could not have access for cataract surgery. Her house still had dirt floors. She didn't have running water. When you see the pictures of the original developers of the community health centers, and you see that they're building houses for people, they're putting in wells and septic tanks. That's where we came from. That it is more than just having your door open to a doctor. Although, don't get me wrong, we got to have that too. But it is all of the other things. Assuring that there's food that is available, transportation, clean environmental needs are being met with water, with power. So, every day in the past 40 years, there's not hardly been a day that I don't reflect on what a privilege, what an honor, and what a humbling experience it is. From the day we began with 4 people, a few patients that straggled in and said, "What are y'all doing in here?" and now we grew. Obviously, we now have 13 physical locations, 4 mobile vans that run around to schools and to many other locations, and a huge myriad array of services that go far beyond medical, far beyond anything, frankly, that in September of 1980 I could not have even imagined. We changed names. We've changed names 3 times. It seems as we grew, the Society Family Health Clinic name didn't fit when we started having offices in other locations. So we changed to PD, Community Health Services. And then that became too much of a mouthful, and it just, that doesn't fit. In 1996, we changed to CareSouth Carolina. And it's been a journey of amazing differences that we've made. Struggles, no doubt about it. But it's like I said earlier, there's just not many times in our lives and opportunities arise that let us know deep in our heart that we are making a difference, and that without us, people wouldn't have dental care, behavioral health services, medical, pharmaceutical, medications that cost have gone through the roof, community health workers that come out and bring you what you need. During the pandemic, our community health services delivered food. Our community health workers are of such value in the community work we do, getting the outreach accomplished, letting people know that what's available, getting vaccinations, getting testing done, social work. All of that is absolutely amazing. Being a part of a community health center is a humbling. It is a purpose that I believe is one that is God given and one that I've never taken lightly. And when people ask me, Ann, you've been there 40 years. I hope I can be here 40 more. I know that's not realistic, but the journey's been amazing, simply amazing.
Wow. I just love to hear what you have to say. Well, all of our directors, so I won't show bias, but I love to hear what the directors of the health centers have to say. I will say it is extra special to hear from you, Roland Gardner, and it used to be Warren Hicks, because you have that history of going back to when not only were you working with your health centers, but then you saw the need for health centers to work together across the state, and were very instrumental in starting where I work, the South Carolina Primary Healthcare Association. And I will say that one thing that flows throughout what you have said, all of you, is that this is a calling. It is a movement. That's, as Marek said, a movement. It is more than about the small businesses that pour into their communities and the access to the services. It is a movement. It's not stagnant. It's a movement, which is why it has been able to. I think part of it is because of the model, and part of it is because the people who pour into the model, that it has been able to stay a movement that has been able to grow and change with the issues that are faced over time. And so I feel very much like you. I kind of came to this by happenstance. I met our CEO, Lathan J. Woodard, at a training that was, I think it was the Black Mayors Conference, and that was years ago. And she said to me, "Oh, I like the way you presented. I have a position, and I'm looking at your credentials. Let me know if you might be interested." And that's how I came to be at the South Carolina Primary Healthcare Association. And I will say that to me, it has also been something that has grabbed my heart. It quickly became more than a job for me because of it being rooted in the community and it being rooted in working with the community to address issues that are important. And, unfortunately, we still are dealing with those issues. So, Marek, back to your question of why community health centers. Well, I have about 3 things to say. One, we still have the needs. Community health centers have done an excellent job of addressing those needs, it just seems the needs keep coming in a different way. So health centers are nimble and agile enough that they address those needs as they come with the new way they have to, or sometimes they have to dip back to the old way in order to address them. But being creative about that, but there's only so much capacity when you have those needs coming with the excellent job that they've done, with a great model, with great staff and leadership to get the job done and address those needs. And also because they give back to the community. I feel that this will be a model that will continue, even if we're able to solve or diminish or mitigate some of those needs, because it has an arm that gives back to the community, because it's a small business and employs people and brings revenue to the local economy. And because it is so broad a model that it can address different types, I think you're going to see the community health center movement for years to come. It may look a little different, but it's going to be here for years to come. And I'm excited about that. So, Ms. Lewis, I would like to hear a little bit more, because I love those stories about how you and Mr. Gardner and others came to work to form the South Carolina Primary Healthcare Association, which is the unifying organization or the membership association for all of the health centers across the state of South Carolina. We actually started in May of '79, and then were incorporated in 1985. Now, those are just the facts. Now I want to hear some of the stories.
Some of the stories. I may have to put a disclaimer here in on this, but yeah, it was, there were a few of us old timers, so to speak. Myself, you've already mentioned one, Roland Gardner, Wendy Winborn, from that area, down in the Low Country area, Orangeburg area. And, we kind of got to know each other because we began to, hear from our funding entities. Every time we wrote a grant where we had these project officers and what have you, and they would share stories with us that, oh, well, there's this the same program that's down in Beaufort, Jasper, and Roland Gardner, and here's telephone. Now, this was the day way before email. So it was, you didn't have email contact and all of that. So we get on the phone and introduce ourselves and begin talking to these folks. We had our very first meeting that I recall, the real meeting, with at least 4 or 5 of us. I think I can remember 5 of us in Orangeburg the first time. And I can remember that in trying to find my way there, it was way before the days of GPS, and you'd look on a map in your car or something. Oh no way. And we came up upon, or I came up upon, this brick building that it was a combination of brick and cinder blocks. And I was thinking to myself, this kind of looks more like a bar, no windows or anything like that. And that's what it was. Wendy had contacts. We had to find a place to meet. And he said, oh, come on, y'all can use this place, and we'll just all meet in there. And, I was thinking to myself, okay, well, I hope none of my board members find out that this meeting is in a local bar over in the Orangeburg area. But we saw folks for the first time face to face. We heard their stories. I did. I heard things that were going on in Beaufort, Jasper, heard things that were going on in Charleston at Franklin C. Fetter, that how they were working, to get folks wells dug, clean water, how Orangeburg folks were working to get more physicians and nurses and what have you into their community. And realizing, none of us can do this alone. We have to hang together. We have to be together because, and when we're together, we have strength. We have each other. We can roll with the good things and the things that are tough to get over. We kept meeting. We actually started getting a little bit of attention from the state just a little bit of the Department of Health attention. Then the feds, in their great wisdom, decided that as the community health center, well, they weren't even called that then, were beginning to grow in South Carolina, but there was a lot of political shifting around. And this was during Reagan years and things like that. And there was a movement about that the federal entity that was funding us, HHS back then, was going to, instead of giving individual grants out, and we had a good little toho of organizations then, I can't remember exactly, but less than a dozen. But we had a pretty good little toho. And instead of each of us getting our grants, instead it would be block grant to the state. And who knows what would happen after that. It would get sucked into one of the big agency coffers, and we may not survive that, the block grant era. Those were pretty stringent and tough times. The governor formed a primary care task force. I actually served on that task force. Senator Leatherman, bless his soul, actually was the leader of that task force. And we had one mission. And frankly, that was just to tie things up so much that block granting to the state would be a bigger problem than it needed to be. And DHEC wouldn't be interested, and Medicaid wouldn't be interested, and all, let's just leave things alone until the political climate died down. That didn't happen in some states. Some states actually ended up with some block grants that changed the face of how their community health centers evolved. We were lucky. Well, we were probably more than lucky. It was a lot of hard work, assuring that that block grant process didn't impact South Carolina. And those of us with individual grants, all the community health centers back then could still get those grants and function with our own boards and so forth. But that put us kind of on the radar screen. We had our first office at the State Health Park, a little tiny little room. The Department of Health said, "I reckon we got to take y'all seriously. Here's some space." Got some really good partnerships with folks out of Georgia, and started applying for grants when they became available. And now we have the beautiful office over there. We've got, I don't know how many staff, but it's not just about growth or empire building. What we do, either as an association or as individually, is make a difference, identify needs, react to those needs, listen to the community. I've been really proud of the journey of our Primary Health Care Association. It's been one that is truly exemplary in terms of responding to the community needs, rising out of some pretty dire circumstances at some points, but yet still being a leader. And that was never more clear to us than the few years back when our very own Lathan Woodard became the national chairman of all throughout the United States of community health centers across the United States. We've come a long way, but as Vicki said, the journey's not done. We still face in our nation healthcare issues and needs that do not rank the United States up as high as most of the other industrialized nations. We need to get there. Our cost of care still remains high. Our patient experience, especially over the last couple of years, has really taken a beating. We've got a lot to learn. We've got a lot to tackle. And let me tell you one thing. If there's any entity across the United States, whether it's a hospital system, and I may be treading on some dangerous ground here, or whether it's an insurance or what have you, I don't think there is any entity poised better than community health centers to really be leaders in where our nation needs to go next in healthcare. That it's cost effective, quality beyond what people expect, and with a patient experience that being led by boards that are patients themselves is unbelievable. I get off the soapbox.
Well, I don't know if you can get off your soapbox or I'm going to hop on the soapbox with you. Rick, I think you were going to say something.
No, 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 no. Go ahead.
Oh,
Go ahead.
okay. And I will thank you, Miss Lewis, for the comments you made about the association. I think part of what makes us who we are and has led us over the years to where we are and where we will go in the future is that we have a great staff and we also have great members who we work together. We're all of us make up the association. Sometimes you see associations where people just refer to the staff as the association. But the feeling here, it is all of us rolling up our sleeves, whether it is, as Ms. Lewis and I do from time to time, whether she sends me a text or email, did you see this? This is what's going on. And I was like, well, let's have a quick chat about it. And I know she's been doing that for years with Ms. Woodard. But having that opportunity to really work with our members on identifying problems and needs and then identifying solutions. That's what I think is so important, and how we at the association assist the health centers who are on the ground, boots on the ground, working to provide this care is by ensuring that we have opportunities for that networking, opportunities for that strategic planning through how we meet with our the leadership and also the various different types of staff at the health centers. We have a broad way of communicating that information and then providing training, technical assistance, making sure resources are disseminating and educating our elected officials. That's a piece that we do off to the side, and capacity building with partners. So that's how we have been set up to assist the community health centers, and we look to the leadership of the health centers to keep us on point, to let us know where they feel we need to move in what direction, by making sure we are up to date on things that they experience and how they experience it. We might know it and be headed in a direction, and they give us that extra piece of information that says, and this is how it's directly impacting us. And we certainly appreciate that. And that helps us to respond. I'll go back as she was sharing the group coming together. I noted in going back over our history, I know the big bullet point pieces, but I had to be reminded of a few that could have slipped by, which I think is important because even at the association level, with the first board that was formed, there were 3 consumer representatives and a provider. So diversity and perspective has always been key to even the work that we do at the state level. And then we have grown from, having an executive director and then maybe 2 or 3 staff to now we're at upwards of 20 or more staff. So that's where we are. And we are appreciative of the work that we get to do on a day-to-day basis with health centers. And I can applaud the work that we also did around COVID and the pandemic, and being a response to communities that was quick to respond. It showed partnership because we worked with state agencies, federal agencies, et cetera, to make sure that we were able to respond to the needs, be it for testing, immunization, as well as treatment. And again, I'm going to tout CareSouth because y'all were one of the centers. Actually, I think you may be the only center that has had the infusion therapy to be able to treat, and appreciate you as well as our other health centers. But I will definitely give you the kudos here for COVID, with the COVID response, of having that distinction, and always being looking to see how you can better serve your community, not just your patients, but your community moving forward. So,
next week we are having our first staff meeting that we've had since December 2019. We generally meet about 3 times a year, because in these past 2 years, we have gained a lot of employees. We're about 620 employees, and in order to meet safely, it's been a real challenge. But next week we're actually going to have 2 meetings, and we're splitting our employees so that half will come on Wednesday and half will come on Thursday, with the same content on both days, so that we can safely meet, not all crowded up. We meet at the Florence Darlington Tech building called SIMT. But as I was getting prepared, I do a plenary in the mornings there after there's departmental meetings. And since about April, I've been pulling together a document, and I've been asking staff to also contribute. It's reflections of this past pandemic couple of years. And I've asked folks to think about things that went on, what you changed, what impacted you both at work and at home. And then I've started a little timeline kind of on how we progress through it. And I'll tell you, it has been a very sobering journey, just the COVID pandemic past 2 years and several months. But we started that journey. We started that journey with the Primary Care Association, because as everybody looks back, you remember our first hurdle was around PPE. Everybody, it was a sudden huge demand for masks, for gowns, for face shields, the whole 9 yards. And many of us were caught flat-footed with that. And the association stepped right in. I don't know how they magically did what they did in some cases, but as we got through the hump of those very early days, and we were scuttling, we were moving stuff from site to site. We didn't have too big of a dramatic issue or problem. We had some problems, but then the association stepped in, because normal supply chains just shut down. And we didn't know how to navigate, but y'all saved, you saved our staff just an enormous amount of anxiety and help, and it was incredible. So as I was reviewing our journey and remembered that, yay, Primary Care Association, we couldn't have done it without you. We literally couldn't have. But yeah, Vicki, this little reflections document that I've been doing, as I look back and I see we've done almost 40,000 vaccinations, 40,000. 60% of those vaccinations are to non-white. They're to our African American and Hispanic population, 60%. We've done testing, more than right at 60,000 tests. Not to mention the free at-home test kits. Free at-home test kits for y'all of those that listen to this podcast. We have them. Come and get them. And then, as Vicki referred, the treatment that rolled out in January of 2021, the monoclonal antibody infusion, has been a lifesaver. We've done we've done over 11,000 infusions. And what this is an IV. You have to come into our Hartsville office, and you get an IV, last about an hour or so. The stories that I've heard out of that, the folks that come in scared and worried and feeling so terrible as they sit there and they receive their IV, it's almost like it's it transforms it almost immediately. There are sad stories. There are stories that we can't make a difference. People, particularly those that have not been vaccinated, that ended up in hospitalization, and we've had some deaths with those. We have been the only ambulatory standalone facility in the state that have done the infusions, and we've done them according to folks' ability to pay. And in many cases, we've done more than local area hospitals. We've had a lot of the manufacturers for the different infusion products say, "What are y'all doing down there in Hartsville?" And we've actually had folks come and visit us and provide it, say, "Whatever you need, call us. We will get it to you. We will help you with whatever these supplies are." We just had Department of Health that delivered us, it brought us. We said we needed some more supplies. We've had local hospitals bring us things, well, even the not so local ones. Uh, it's the real heroes that have stepped up, realizing that we really are all in this together. We don't have to compete. We don't have to see who can do the most of this or that. But we need to get services to patients who otherwise wouldn't have access. We've had patients come for infusion from out of state. One person chartered a private plane because his brother had gotten the infusion with us and he couldn't get it in his state at all. And obviously, he had the wherewithal. He couldn't fly because he was positive. He couldn't fly on a commercial flight. So he said, "I'm getting to South Carolina no matter what it takes." So it's been one of the most joyful, yet one of the most difficult things to witness. We've had folks lined up at 5:30 a.m. in the cold, waiting to get the infusion. So yeah, it's quite a journey. But hats off, South Carolina Primary Health Care Association. We couldn't have done it without some of that PPE in the early days.
And that story does really speak to, again, as I said, how we work together and collaborate. Because if we didn't know the need, we weren't going to be able to address the need. And again, rolling up our sleeves at one of our meetings or several of our meetings, which we have designed so that we can get that input and really think through strategically how we handle certain things. And the directors in their discussion, we were attentively listening, and it allowed us to come up with, well, maybe we can do this. And it helped for us to be able to provide that support. And again, that is what our role is here, is to provide the support so that health centers like CareSouth Carolina can do what they do in the community. And one other thing that just struck me, Ms. Lewis, is when you spoke about how you partnered with other entities in your area. That speaks volumes about how CareSouth Carolina sees getting the work done. You clearly understand something that I said earlier on in the podcast. It's just that no man goes alone. If you think you do, I'm sorry. There's going to be a wake-up call at some point when you recognize that you are connected to someone else. You may not feel it right now. It may be invisible to you, but all of us are dependent in some way or another, directly or indirectly, with others. And y'all grasp that from, leadership down to staff. Daniel, I haven't worked with you that much, but I have worked with Marek on things. His first thought is, well, can we bring somebody else in? Or this is what we're doing and this is who we're partnering with. So that to me is a part of your organization's culture, is how do we work together to collaborate and get the job done?
And it wasn't just in the response to the pandemic. The pandemic drove home to us that you can't wait until there's a crisis, till there's an emergency like COVID. We had to know churches, law enforcement people, other agencies. We had to already know that. They had to already know and trust us, so that when the chips came down and we needed to get shots in the arms, we could turn immediately. And folks said, "Oh yeah, I'll do it. I'll do a video. Put me up on a billboard, whatever it took. It was amazing, absolutely amazing.
And I think that's what takes us back to, I'm going to go back to where we started with the model. The mission of the model is that community health centers, which by the way used to be called neighborhood health centers too at one point, were established to provide dignified, accessible, comprehensive, and community-based and driven care. If nothing else, we remember from having this podcast celebrating National Health Center Week, I think that is ultimately important for all of us to keep at the forefront of our mind. And it's done by three key elements: the community health services that you're used to seeing on the front end, the economic development that comes and you may not see as much, or it may not come to your mind as much when you see the CareSouth logo, but because they're a small business, the economic development, and then the community participation. That's what makes it work and run.
Wow. Wow. You get all that, dang. You get, I'm full. I can't speak for you, but I'm full.
Have
Yeah,
there been any questions on Facebook or anything?
I think they just taking everything in him, and there's a lot of hearts and thumbs that's going up. The one thing I got to say about the health center is that where I live, I work where I live right here. I mean, I went to the school that we are housed in right here in Latta. And for years, we didn't have a permanent medical facility that offered continuous care. And so people were really kind of leery about CareSouth when they came in. How long they're going to be here? When they leave? And they just temporary? But over the last 7 years almost, we've been here. And we have CareSouth has become a mainstay amongst the citizens in this community. And it was a real big deal to them that you can go to a place to see your doctor. You can leave your doctor's room, and then you can go right down the hall and get your medication, and you don't even have to spend any extra gas money, right? And then with the integration of other services like community health, so if I don't have insurance, or if I need to apply for SNAP or anything, I can do all of that stuff in the one building and don't have to go to a whole nother city to get it done. So having those services right here in a building that's considered one of a big historical site, because it was the all black school at one point, but to have those services here and have those people that can drive by and just look and see history in the making from the past and from our present past, that we have a place here to offer all types of services, and that's become a place to embrace the needs of the people here is awesome. We get a lot of compliments that this is they have never heard of this before. And so that's why talking about it is so important, because before CareSouth coming to Latta, and of course it was in Dillon and it was in Lakeview, but Latta, the small town of Latta, got a place that has everything in one building up under one roof. Chiropractic services, dental, everything that you need under one roof was unheard of. And so it kind of scared them. Well, there is no way I can be a part of this, and it's going to stay. I don't want to get used to it. And then they leave. And over the years, CareSouth has gained the trust of the citizens in Latta, and they know that they're going to be here for the duration. And so that's why our numbers have picked up, and people are flocking indoors to see the providers that we have here in Latta. So me personally, I thank God for CareSouth, because it was a godsend. So, yeah.
I have a question, just kind of piggyback on what Daniel said early on, understanding that model of almost holistic approach to community medicine, if you will. Can you talk about what the type of pushback that you all received early on when you introduced this model and tried to kind of walk into the already the systems that were already in place? What kind of pushback y'all got from when you came about?
If y'all hadn't figured out by now, I'm an old hippie. I've been in the middle of the Vietnam War, the war on poverty, the civil rights movement, and everything. So whenever we would apply for a grant in those very, very early years. We were still Society Health Family Health Clinic, and even through the days that we were PD Community Health Services, when the Health Systems Agency was still around, you would have to have the first level of review by the HSA. Well, an HSA would hold these public meetings for it to come up of what the community thought about this little place in Society Hill that was applying for this grant. Well, our healthcare industry has not always been very supportive of programs that had the federal tag attached to it. So it wasn't necessarily a welcoming type of approach that we had, because we were going to be a federal grantee, was going to be offering services, hiring what was frequently seen as competitors to their practices in the local surrounding community. There wasn't anybody local, but the surrounding communities. So oftentimes we would be in those public meetings, and there would be a pretty considerable outcry from other outside of the local community, but these would be surrounding communities. So in anticipation of that, one time we got a busload of the local society people. The surrounding communities can have their voice, but it became kind of evident that their voice was one that did not reflect the folks that were there directly in Society Hill, that would directly be receiving the services. And that was the old hippie in me coming out. We'll just get a busload. We'll take them. We'll show them. We got voice too. It makes up for some interesting evening meetings.
Right. Absolutely.
And
what
I'm
sorry. Go ahead, Miss Vicki.
What I would say from the state perspective, I've been with the association 15 years now. So what I would see is maybe not so much pushback, but people not understanding the model. And if they don't understand the model, sometimes they inadvertently put roadblocks in place, or they cause us to have to step back and delay some of the things or how we would approach it, because they're not totally understanding the model. Now, whether they intentionally don't want to, or it's just they don't truly understand it, to me has been one of the things that has caused the most challenge for sometimes some of us getting the work done when we want to get it done. Which means it's always important to have those advocates who you're able to make sure they know these elements. They know that it's affordable, and they know that, yes, there is a part where patients are paying for or part of the sharing the cost for their care, but it's based on what they can afford. Right. So those elements, sometimes people get confused, and it has caused them to feel, as some people would say, some kind of way sometimes about the model, but it's just because they don't understand. So us taking the time to explain things and educating and re-educating sometimes, I think is something that we can always take command of and do to eliminate some of those challenges. And before you add something else, I would be remiss if I did not say that there are a total of 23 organizations across the state that are implementing the model through direct care delivery as CareSouth is. So there's a presence in every county in the state of South Carolina.
Absolutely. And I'm glad you said that too, because I was going to commend you and the association for bringing the community health centers together. Because one thing I realized, we all know each other, right? I mean, we literally really know each other, and when we're thinking about things, it's like, I wonder if such down in beautiful Jasper or New Horizon, they're doing the same thing. They have a similar program that we're looking at. And we reached out on different occasions that they reached out. It's always a good collaboration. It's not that competition. It's always been that good collaboration because we, through the conferences and different meetings that you have, we built relationships. And, and relationships are key to success. And so I commend the association for taking that, make sure that we all come together and know each other and able to collaborate, work together. And of course, for her leadership, leading CareSouth today, and we look forward to even more opportunities, journeys, and opportunities to work with PCA and in future endeavors. I'm full. I'm full today. Y'all poured so much into us, and we like to thank you for taking the time out of your busy schedule and spending almost an hour with us, talking about the history of CareSouth, the history of the Community Health Center movement, the PCA, and just educating us on who we are, right? It's always good to, even for folks that work at the centers, it's good to know again and hear that, because I hear different things every time we bring, we had Miss Carolyn Emanuel on last year, and so it sparked an idea that me and Daniel was texting back and forth about for next year, and so thank you, thank you, thank you.
And thank you for inviting me. Ms. Woodard would love to have been here too, but she actually had a conflict. So I'm glad I got to be the pitch hitter for her. Thank you so much for.
You're never a pitch hitter. Vicki, you're never a pinch hitter, but yeah, thank you. I hope I don't get too much on my soapbox, but I love the community health centers in CareSouth and the Primary Care Association.
Absolutely.
So Ms. Vicki, just count on us getting you back on. And anytime you need this platform to get any information out, we're available to you. We are at your disposal.
Thank you so much.
Absolutely. And if any other centers or entities out there is looking to be an ally or with the PCA, could you give them the contact information over there?
Yes.
Yes.
Yeah, we'd be more than happy to highlight them as well. I mean, we're all family. We are family, right?
So what's your website and your contact information?
Our website.
Yeah,
I'm sorry.
I
am so sorry. Our website is www.scphca.org.
Right.
And my contact information is Vicki, Vickiy, for the first letter of my last name, at scphca.org.
Absolutely. Thank you so much. That's for those that want to be an ally and support what community health centers across the South Carolina are doing, and even across the nation. If you want more information about CareSouth Carolina, you can reach us on our website at www.caresouth-carolina.com, or you can contact us at 866-498-0399, or check us out on our Facebook page, like and follow us on all of our social media platforms as well. Thank you again for being here. What a way to put it almost an end to Community Health Center Week. We thank these dynamic ladies for their time. And listen, we'll see y'all next week. CareSouth Carolina Community Live Podcast.
Y'all stick around just for a minute, but right before you hang up.